daily life, it was very hot there. People would try to get out of their tents, and you'd find most of your patients, if you started looking for them after 10 or 11 o'clock, they'd be under the trees. Kids will be kids. There was a large area, and there were always soccer matches going on with the kids who were not injured, although there were kids with X-fixes who were out there playing soccer as well. The bottom right shows sort of an overview. John one day was able to get up on the roof of one of the buildings and was taking pictures, and this is an overview of the patient tents there on the bottom. Again, since it was pretty hot, all of our clothing got pretty gross pretty quickly, and they did have women who were paid to do laundry, and they did a real good job. Anyone who liked beans really enjoyed the food there. I didn't particularly care for it, but it was, we had the same food as the rest of the camp, and it was nutritional. It was just sort of the same. And sardines I had for the first time, and I'm sure it'll be the last too. We had a different kind of filing system than we do here. This was a typical bag that you would carry around with you for your wound care rounds. I'm just going to cycle through these pretty quickly. These, the second half of the week, I was taken out of the PACU because they had an extra anesthesiologist who took over for me, and so I took over 2 rows of tents. I had 54 patients, and we made rounds through the day, and my patients were the ambulatory patients, so they were actually in pretty good shape, but they still had some pretty devastating injuries. They didn't discharge the amputees. They were hoping that someone who was going to give a prosthetic or come up with a prosthetic plan would be there, so they didn't really want them going off into the community, and so these guys were in pretty good shape, but they were just waiting. This young girl had her arm crushed by a block and had a pretty devastating wound that really needed twice-a-day care. Kathy took it from a very nasty state to something much better by the end of our week. I think in another week it probably wasn't going to need wound care. These are just some of the people who needed physical therapy. This young boy had had a growth plate injury and really was having difficulty and had to have physical therapy every day. Unfortunately, physical therapy left again halfway through the week, and they had about 4 or 5 days before anybody else was going to come. You know, this is considered the main rehab hospital in this part of Haiti, and yet it seemed like people sent a lot of doctors like me and not so many physical therapists and nurses. Again, these are some of my smiling patients. The lady in the orange, she was waiting really for a wound to heal so that she could have definitive surgery on her ankle. When you think about how we say, oh, somebody's got an unstable ankle fracture, they need to be in the operating room in a few days. You know, she's sitting there at week 5, and she will eventually get her surgery, but not quite the same. Again, just some young girls. This woman she's 19, had a particularly tragic story. This day she was feeling very unhappy because, as you can see, on her one foot had a mid-foot amputation, and she went to the OR expecting her other foot to be fixed, and when they took off the cast that had been put on somewhere else, there was a skin graft that we had no idea was there, and it was sort of in pretty bad shape. And when the doctors explained to her, well, we're going to take care of the skin graft, we don't want to operate on it right now because you could have an infection and lose your foot, there's always, even though we had pretty good interpreters, there's always something lost, and she interpreted that day that she was going to lose her foot, and so she was obviously very distraught. By the end of our week, the orthopedist had arranged for a specialist in ankles to be seeing her the following week, who was bringing down custom sort of replacement bones for her, and so she was going to have a successful surgery in a week or so from when we left. This was my personal favorite patient. I had him from when I was in the PACU through his early days afterwards, and the thing that was just so amazing is that by day 3, when he had had this just incredible surgery, all he required was ibuprofen, and all he kept doing was say thank you, and no complaints about pain. It was just amazing. I had a medical record that was paper initially, but I'm a geek, and so I used my laptop to come up with this thing because I just couldn't figure out which patient had what by looking at paper. So one of the things that was wonderful as the week went on, we got in contact with the USS Comfort. They had initially been very overwhelmed with patients, but at the time that our week was there, they actually didn't have enough to do. They came over and evaluated our camp and found that, we were doing a good job and felt that they could help with some of the most difficult orthopedic procedures. And one of the things they liked about us is the fact that they could take the people away but bring them back. That initially the Comfort had operated on a lot of people, but they didn't have any place to put them afterwards. And so we had 24 or so of our most difficult patients airlifted out. This is a picture the day before we left. We thought that the camp was going to have to go to backup water supply. When they were trying to chlorinate the water, a backhoe by mistake took out the main water line. So we immediately had notification across the camp that water's, there's no water, nothing you can do. And John French, he's not here today, but is an emergency department nurse, used his skills that he had from being a plumber in another life and was able to direct people how to fix this. He found the right equipment and really saved the camp, because you figure we had over 250 patients there, over 60 staff, and they had some water stockpiled, but they would have been in big trouble without it, and he had it fixed in about 4 hours. It was pretty impressive. Our last day we had a distribution of food and clothing. Okay, we're doing a distribution today. Everyone with a ticket will get a packet of snacks and a towel. But what people are most excited about are the clothing that has been donated by various people.